Hello, I am Dr. Nasmani. This is the second part of the basic principles of ECG analysis. This is actually a series of more than 10 videos. Each video will be around 15 minutes. You can use the pause button and play button to control the speed on the video streaming if it is too fast. In the part 1, we have been talking about the P wave before each QRS complex with a constant PR relationship, and the QRS was regular with a trill P waves rate of less than 100, 100 to 220, 220 to 260 and 260 to 320. Within this classification, we look for the P wave morphology and PR interval, and the various conditions were told. The various examples will be shown in the videos which are coming in the subsequent telecast. Now the second important step in the detection of abnormality is the P wave coming in front of each QRS complex, and the P wave and QRS are related. The QRS is whether it is regularly irregular or irregularly irregular. This is the first step. If it is regularly irregular, that is QRS is regularly irregular, then look for the atrial P wave rate. The atrial P wave rate can be less than 100, again 100 to 200, 220 to 260 and 260 to 320. See, if the QRS is irregular, but it is regularly irregular, and the atrial P wave rate is less than 100, it can be sinus rhythm with ectopic or sinus rhythm and second degree heart block. If the atrial P wave rate is 100 to 200, then it can be sinus tachycardia with ectopics or atrial tachycardia with block. If the P wave rate is 220 to 260, it is atrial flutter with block or atrial tachycardia with block. If the P wave rate is 260 to 320, it is atrial flutter with block. So that is QRS regularly irregular. Now if the QRS is irregularly irregular, and if the atrial P wave rate is less than 100 or more than 100, if the atrial P wave rate is less than 100, it is wandering atrial pacemaker, and if it is more than 100, it is multifocal atrial tachycardia. So this is the second algorithm which I would like you to become familiar with. Now here another algorithm I am showing, which shows how to interpret when P wave and QRS complex are not related normally. Here the P wave is seen, but not in front of each QRS complex. Now look for whether the P-QRS relationship is fixed or variable. See the relationship between P and QRS. From each R, count the small boxes towards previous P wave. There are two possibilities. One is it is a fixed relationship, or it may be a variable relationship. If the PQRS relationship is fixed, that is fixed retrograde RP interval, then look for the QRS duration. Again, in the similar way, if the PQRS relationship is variable, then also look for the QRS duration. Now let us go further deep into the analysis of the algorithm. The first part is P wave seen but not in front of each QRS. Then we look for PQRS relationship fixed retrograde RP interval. Then we look for the QRS interval. And if it is less than 0.12 second or more than 0.12 second, that is the next step. That QRS is less than 0.12. If it is less than 0.12, look at the ventricular rate. This ventricular rate can be less than 100 or more than 100. If the ventricular rate is less than 100, it is junctional rhythm. If it is more than 100, it is AV nodal reentrant tachycardia or AV reentrant tachycardia. Now the second part of the algorithm, P wave seen, not in front of each QRS. PQRS relationship is fixed, that is fixed retrograde RP interval. Here the QRS duration is more than 0.12 second. Again you are looking at the ventricular rate less than 100 or more than 100. If it is less than 100, it is junctional rhythm with aberration or accelerated idioventricular rhythm. If it is more than 100, it is AV nodal reentrant tachycardia with aberration, ventricular tachycardia or AV reentrant with aberration. Now the third step, that is P wave seen but not in front of each QRS. PQRS relationship is variable. Here again we are looking at the QRS duration. Just like the previous example, it is 0.12 second or more than 0.12 second. If the QRS is less than 0.12 second, look at the ventricular rate. Again, less than 100 or more than 100. If it is less than 100, it is complete heart block with junctional rhythm. If it is more than 100, it is AV nodal reentrant tachycardia with block or fascicular or bundle branch tachycardia. Now if the QRS is more than 0.12 second, again look at the ventricular rate, less than 100 or more than 100. If it is less than 100, complete heart block with ventricular rhythm or accelerated idioventricular rhythm. If it is more than 100, it is ventricular tachycardia or AV nodal reentrant tachycardia with aberration and AV block. Now look at another example, that is another algorithm where there is no P wave seen. Look at the QRS whether it is regular or not. If it is regular, that is yes, then look at the ventricular rate. If it is ventricular rate is less than 100, look at the QRS duration, whether it is less than 0.12 or more than 0.12. If ventricular rate is more than 100, look at the QRS less than 0.12 or more than 0.12. No P wave seen but QRS is regular. Again look at the QRS duration, again less than 0.12 or more than 0.12. This is a simple way of expressing what I told you already. So this is the mental picture you should have. So here there are no P wave but the QRS is regular. Ventricular rate less than 100. QRS is regular. Ventricular rate less than 100. Junctional rhythm with or without aberration. Accelerated idioventricular rhythm. QRS is less than 0.12. Junctional rhythm more than 0.12. Accelerated idioventricular rhythm. Junctional rhythm with aberration. If the QRS is regular, ventricular rate more than 100, AV nodal reentrant tachycardia with or without aberration, AV reentrant tachycardia with or without aberration, junctional tachycardia with or without aberration, such as digitalis toxicity, ventricular tachycardia. Then QRS duration less than 0.12 second, AV nodal reentrant tachycardia, AV reentrant tachycardia, junctional tachycardia, QRS more than 0.12, AV nodal reentrant tachycardia with aberration, AV reentrant tachycardia with aberration, ventricular tachycardia and junctional tachycardia with aberration. No P wave but QRS is regular, QRS is not regular. Then look at the QRS duration. Less than 0.12 is atrial fibrillation, more than 0.12 is atrial fibrillation with aberration and ventricular tachycardia. So that was the end of this presentation. Please visit the channel youtube.com/acpgmet. If you got Facebook account, please make friends with the facebook.com/acpgmet. After inviting as friend, click like. Similar sessions will be following. The third part is coming for the ECG analysis, which is a series of video presentation. Thank you.